There are serious concerns about the impact of a 7-day NHS in England. That's according to documents leaked to Channel 4 News and The Guardian newspaper. The government has promised a truly 7-day service by 2020.
But the leaked confidential review, which was carried out by the Department of Health, identified 13 risks, including concerns over a shortage of doctors and other health staff. We're joined now by Jeremy Taylor, who's Chief Executive of National Voices, a coalition of 160 health and care charities, and Dr. Jeeves Wijesuriya, who's a junior doctor at Homerton Hospital in East London. Good evening to you both. Jeremy Taylor, to you first. I mean, this is a report by Jeremy Hunt's own advisors identifying 13 risk areas. How damaging is it?
Well, in one sense, it isn't damaging at all, because you expect government departments to be managing risk, doing worst-case scenario planning, making sure if they have a big project that they've thought through what could go wrong so they can make sure that it doesn't go wrong. So in one sense, this is reassuring because it shows the government is doing some planning behind the scenes, which has been made public. On the other hand, I think it reinforces a lot of concerns that many people have, patients, doctors, and the public more generally, about the workability and affordability of a genuine 7-day service. So what the government hasn't done is really spelled out what they mean by a 7-day service. Not everything needs to be done on a 7-day basis. Some things do. Emergency services need to be 24/7. GP services don't. So what you have to do is to work out what you really need to have on a 24/7 basis, and make sure that you can staff it, have the right people in the right place at the right time, and that you can fund it. And I think there are questions about whether the government has got all its ducks in a row on those issues.
Yeah, and Dr. Jeeves Wijesuriya, I mean, staffing is an issue we're already talking about in a 5-day NHS service, isn't it, with rota gaps already causing problems in hospitals, and it's something that was discussed at length over the junior doctor contract.
Well, I think the first thing to say is that we have a 7-day emergency service. What we are talking about is stretching 5 days of elective cover over a 7-day period. And the problem that this risk registers leak highlights is that actually not only are there 13 areas of huge concern, one of which is an absolute red alert about staffing problems. This completely validates all of the concerns that junior doctors have had, patients have had, patient safety experts have had, that the Royal Colleges have had about the plans that the government have. And actually what this does identify is actually that not only have the government known about these problems, but they haven't acknowledged them, that they haven't done anything to address them. This completely validates what was raised by the Public Accounts Committee, who said that, and I quote, that these plans beggared belief, that there was so tiny a notion as to how this service would be funded. I think this raises huge concerns. I think this highlights the fact that actually there is no plan for a 7-day service, something the BMA have been asking Mr. Hunt and this government for over a year now.
Jeremy Taylor, Jeremy Hunt has said he's going to implement these changes by 2020. The funding is going to be there in order for these changes to take place. You get the sense now that the changes are going to happen regardless if more leaked documents such as the one that we've seen come out or not?
Well, we simply don't know. I mean, that's still 5 years away. What is clear, and I think Jeeves is right about this, the NHS is currently under huge pressure. Most NHS trusts are in the red. Waiting times are going up for patients. The service is under a lot of stretch. So if you're going to introduce a 7-day service, you need to be really clear about what your priorities are. For us, the priority would be make sure that the service is safe, so that how good and safe the service you get doesn't depend on what time of the week you fall ill. That seems to be the most important principle.
So the weekend effect.
Yeah, and I think the government is absolutely right to say we need to make sure we do everything we can to minimise the weekend effect. But we haven't seen enough about what those plans look like in practice. And I think there are questions about what can be afforded and whether there are enough staff in the right places to be able to do that effectively. So I think what we would say is the government needs to work very closely with patient groups, with doctors, and with experts to make sure that what plans it comes up with are actually achievable.
Dr. Wijesuriya, is there any way that you can meet the government, Jeremy Hunt, halfway on this? For many people, a 7-day NHS would be the way forwards in order for them to be able to benefit on the weekend so you don't have that weekend effect.
I think the first thing to say is that doctors, the BMA, all of us want the best possible care for the NHS, for patients. We want the best possible NHS we can. If there is the ability to deliver a 7-day elective service, we would absolutely be behind it. The problem that we have is actually these are uncosted, unfunded plans, criticised both sides of the aisle. Sarah Wollaston talked today about the thin evidence being used to bolster these policies. Dan, who was the Secretary for Health previously, has highlighted the fact today that actually political sound bites are being used as the reason for calling for these changes rather than actual evidence. The problem we have is this weekend effect, which has been discredited by the author of the original article. And earlier today, the DOH's own experts were saying that they don't believe that this weekend effect is due to staffing levels. I think actually what we're seeing is Jeremy Hunt misusing the data, and rather than resolving some of the issues that there are in delivering a service, in fact, he's making them worse with his plans for junior doctor staffing. We're seeing 1 in 7 trusts reducing and closing services rather than actually trying to address these problems.
OK, Dr. Wijesuriya, sorry, time is against us. Jeremy Taylor, Dr. Jeeves Wijesuriya, thanks for joining us this evening on Sky News tonight.
Thank you.